Rachna, how are you?
Hi, I'm fine. How are you?
I'm good.
Hi, Dr. Ashna. We can start now. Thank you.
Okay, hi. So, welcome everyone. And today we are here in the session to discuss about the exam MRCPCH and particularly focusing upon MRCPCH Part 1 and also how to strategize for the last 2 months because we have our upcoming Part 1 exam in the month of October. And yes, to discuss the new format which has been brought up by RCPCH in the theory exam. So yes, let's get started. Okay, so something about myself. I am Dr. Ashna Verma. I have done my MBBS and MD Pediatrics from India. And I have done my MRCPCH. And I started the journey in the month of Feb in 2023. And after giving my Part 1 and Part 2 exam within a gap of 6 months, and then going up to, giving the clinical exam just right after my result of Part 2. So the entire journey was of 1 year from Feb 2023 to Feb 2024. And it was all in one first attempt. And I believe if I can do it, you also can do it. Okay, it is a doable exam. Let's start with the belief that we all can crack it in the first go itself. All right, so I'm currently a practicing pediatrician, and I have now joined MedExam Expert as mentor for Part 1 preparation for MRCPCH. Right. So about this exam. This exam is about membership of Royal College of Pediatrics and Child Health. And why is it so important and what is the hype about? So it has international recognition. In most of the countries, this degree is considered a very prestigious one. And it does let you go through a lot of rigorous evaluation, which when you give and when you pass it, you come out to be a better clinician. And moreover, it gives you GMC registration, that is General Medical Council registration, which is important to practice in UK. And despite giving you registration, it also gives you direct entry to the training system in United Kingdom. You once you pass this, you get into ST3 or ST4 level in UK, and you practice as a pediatrician there. All right. So about this exam consists of 3 theory exams, which is Foundation of Practice and Theory of Science, FOP and TS. These two make the Part 1 of exam. And then there is Applied Knowledge in Practice, which is AKP, which forms Part 2 of the exam. So the good thing about this exam is you can take these theory exams in any order you want, okay? Despite FOP and TS being a part of Part 1 exam, you can give them separately as well, okay? So they can be taken separately, and also you can take Part 2, that is Applied Knowledge and Practice AKP, before giving FOP and TS. So it depends upon you. But once you have cleared these 3 exams, only then you become eligible to appear for the clinical exam, which is actually considered to be the most toughest exam of MRCPCH. Right. So about Part 1 exam, we have TS. So this particular exam, TS, tests your basic scientific, physiological, and pharmacological principles of clinical practice and of evidence-based practice. So, in TS, they are basically trying to test your basic sciences, that is anatomy, physiology, pathology, pharmacology related to pediatrics. Okay. So it includes very basics, and this is what you build upon. Okay. Then comes FOP. FOP assesses a candidate's knowledge, understanding, and clinical decision-making abilities. It aims to ensure you have reached the standard of someone entering core specialist training. So, in FOP, they basically give you a question in which you are given a scenario and you have to make the diagnosis. You have to come to the diagnosis, and then you have to plan an investigation or a management plan for that patient, or to tell about which is the next best step or the next best treatment for this patient. So this is about FOP. They basically judge more of your clinical decision making. Okay, so this is a very frequently asked question to sit for FOP and TS together or separately. Okay, so what I would say is, if you are someone who is well aware of pediatrics, and if you are practicing pediatrics, or you are into your residency or training program of it, and you have a basic knowledge of it, about the subject, it is better to go for FOP and TS together. The logic being, the topics which are being tested are same for both of them. Okay, just that the type of questions which are asked are different, but the topics are same. So it is always better to sit for both these exams together. But if you are a complete newbie, you do not know much about pediatrics, and you do not feel confident about going for both these exams together, it is completely okay for you to give them separately. Give yourself some time and give it in 2 different sittings. Yes. Then talking about the cell vibe. So here I have enlisted the topics which are given in under which they judge your knowledge, and it includes some major topics which without which there is nothing in pediatrics. Okay, like gastroenterology, hepatology. Then we have hematology, oncology, neonatology, nephrology, urology, and also cardiology. So these are the major topics which forms around 40 to 50% of the questions that we get in the exam. Okay, so like there doesn't make any sense to sit for this exam without knowing this topic well. Okay, and also these are the topics which helps you also understand your patient and treat your patient in everyday practice also. So it is a must-know thing. Moreover, there are a few topics like science of practice, safeguarding, and pharmacology, palliative care, which forms which these are those kind of topics which, if you learn, if you read them well, you can short solve questions. They are easy achievable marks in the exam. So again, this is something which is must do for exam, and it is something which we miss in our day-to-day practice. So yes, it is a good thing to do and to practice before your exam. Right. And then there comes topics like ethics, law, and safeguarding, which are a little tricky. Every time they frame questions, there are minor differences, and those minor differences are enough to change entire answer. So RCPCH, they have made sure that every time they assess your knowledge of ethics and law, it is not from the same questions that have been asked before. They keep on changing their questions. So yes, these are little tricky topics: ethics, law, and safeguarding. Okay, so talking about duration of preparation. So again, this thing depends from individual to individual. If you are someone new to pediatrics, it would take good amount of you can say 6 months to prepare for this exam, and it is always better to form a good basics and read good books. Have some basic knowledge about the subject, and then build upon with the important topics which are asked in the exam, which can take you good amount of 5 to 6 months, okay? But if you are someone who has already, done your residency or done your training in pediatrics, like if you have already done your MD pediatrics, so it won't take very long. But again, because the exam is not an easy one, so you would need somewhere between 3 to 4 months to prepare according to exam, okay? And if I can still say that 2 months, we have still 2 months left to the October, right? So even 2 months of dedicated and focused preparation is good enough to crack the exam if you have some basic knowledge of pediatrics with you, okay? Right. So moving on to the resources that we can use for FOP. These are few of the very important resources that you have to refer to, okay? Apart from this, there are n number of resources which you can find online, okay? There are a lot of free material circulating on the online portal. So, before you get lost in all of them, I would suggest make a list of these, and these are the ones you must do before you appear for this exam, okay? So Clinical Cases for MRCPCH, Foundation of Practice, is a book which has been written by the RCPCH members itself. And, I must say that they have very beautifully made this book. There are some 15 questions, 15 case scenarios given in this book. And they have very rigorously discussed the topic in it. And once you look at the questions and you see their explanation, you can very well understand the entire concept, and how did you reach that answer has been very beautifully explained in that book. So it is a must do book for your exam. And then coming upon to Science of Pediatrics, it is something which, it is important if you have not read pediatrics during your entire preparation. So if you have not done your residency in pediatrics, so Science of Pediatrics is something which you can refer to. It is a very this book has been written in a very easy way, easy language. So it is okay. So yeah, so it is good to go through this book. And then comes Illustrated Textbook of Pediatrics, which again is a book which you should refer if you have not referred any core textbook of pediatrics like Nelson or something else. So yes, these two are good to build your basics of the topic. Then comes Pediatrics Guidelines and Neonatal Guidelines. So for FOP, where they are basically judging your clinical decision making, these guidelines are important to do, because in different countries, slight different management protocol is being followed. And when we appear for this exam, it is important for us to know what is standard treatment protocol in the United States and in the NHS. So it is important to do pediatric and neonatal guidelines. It helps you reach answers, and it helps you know the exact management protocol which is being followed in their health system. Then comes NICE guidelines. So there are many guidelines given by the by NICE. So you do not have to go through all of them, but there are a few topics in which this thing is a must do, like asthma. You must know NICE guidelines. Then comes UTI. Okay, so these are a few topics in which the NICE guidelines are important to refer to. Then RCPCH sample papers are very important when you appear for the exam, because most of the times when you are solving questions, they are a part of recall, which students have recalled from their exam sitting. So when those questions are framed, they frame only those important keywords. They put only those important keywords, and the question seems very small, But when you actually sit for the exam, you see that they frame long questions. The question stem itself consists of 5 to 6 lines. So RCPCH sample paper helps you understand the length of questions which are actually being asked, so that you do not just see the keywords which are readily served to you in most of the question papers. But you also see some distractors, which, comes in every question. With every question, they'll give you some distractors, some keywords, and you have to have that skill of picking up the keywords and reaching the answer. So this way, these sample papers are good to solve few days before your exams. Then talking about past recalls, which are actually previous year's questions. So it's like there is, if you sit for the exam without doing the recalls, I don't know, what can I say, but right, that is just not the right way of doing it. Okay, recalls have to be done before you sit for your exam, and it is better if you are a newbie. It is better to start solving recalls in the second half of your preparation and not really jumping to it and then going for topics. For a newbie, it is best to build upon your concepts first and then supplement that with a few high-yielding topics which you can get from the past year questions. But yes, if you have already done pediatric training and if you have already done your MD pediatrics or so, it is good to go to recalls, see what kind of questions are being asked, and then focus on those topics so that you are preparing in such a way that you reach to most of the questions given in the exams. Then comes past test. So past test, what I personally can say is they give good questions, and it is a good resource for FOP. But because of lack of time, I couldn't use past test, and I didn't feel that it made much difference into my preparation. But it is a good thing to do if you can, if you have time. It is a good thing to go for. And so there are a lot of materials available online where you get past test questions in PDF format. So yes, it is, you can solve them. They'll help you know the kind of questions which are being asked in FOP. Moving on to resources of TAS. So again, we have clinical cases for MRCPCH given by the RCPCH itself. And again, again, this is also a lovely book having 50 questions, 50 cases, and they have very beautifully described the entire concept, entire topic, subtopic, which is being discussed in the question. The explanation given is wonderful. So solve this book before you go for your exam. And then comes Science of Pediatrics. When you're preparing for TAS separately, make sure that you read Science of Pediatrics and go. Okay. And coming to sample papers, again, as I said, it is something which you should do few days before your exam so that you know the kind of question and the length of questions which are being asked. And then again, past recalls are very important when you sit for TAS exam so that you know what are the high-yielding topics and where you have to focus more. And then comes pharmacology files and ethic files. So there are some PDFs which are being circulated in most of the groups online, and we have it in our group too, which you can refer to. So as to have some consolidated knowledge of the important pharmacological topics which are being asked in this exam, and few ethical scenarios which are commonly being assessed in TAS. Right. So moving on to how to prepare. So the ideal way of studying, is in such a way that you read your core book properly and you read it cover to cover so that you have a good concept, good base of your subject. And then you build upon few, here and there important topics which are important for the exam. So at the end of the day, the importance of studying this subject through and through is important. And also you have to be, at the end of the day, a knowledgeable practitioner. To be a good clinician, you need to have the skill, you need to have a lot of qualities, and at the background, you need to be knowledgeable. So definitely, it is important to read your core book properly. But when you are talking about going for an exam, it is it is always good to, have the wise way of studying, which helps you pass the exam. And I'll talk about the wise way now. So the first step of doing that is know your exam, okay? Know your exam pattern. It is best to, understand that there are few questions which are repeatedly being asked, few topics which are repeatedly being assessed in the exam, okay? And most of the times, these topics are the ones which, you commonly see in your day-to-day practice. For example, celiac disease. It is something which is common in UK, and you come through it in almost your everyday practice. So it is very obvious for them to expect you to know that topic. Hence, it is important, first of all, for you to know your exam and what kind of questions are being asked and what kind of topics are being assessed repeatedly. Then comes identifying high topics and pattern recognition. So definitely there are few subtopics within the topics also, where there are subtopics which makes a major chunk of your question. For example, diabetes mellitus. I don't know if there has been any diet of MRCPCH exam where they have not assessed your knowledge of diabetes mellitus type 1. Okay, it is a very, very important topic. And you have to, for sitting for MRCPCH exam, you have to know diabetes mellitus through and through. Okay, and I'm not saying that they repeat questions, but they repeat the topic. Okay, do not get me wrong. It is not the question which is being repeated. They are very particular. RCPCH now, since last 2 to 3 years, they have been very particular of not repeating the question the exact way. They repeat the topic and they frame their question in a different way. Okay, so yes, identify the high-yielding topics and recognize the pattern, the kind of pattern that they have. How much weightage they are giving to what topic. And there are few topics which are assessed on and off. They are not being assessed every time. So it is a fair game to maybe skip on it if you have less time. But yes, you can invest the time that you save on topics which are being assessed every now and then. And yes, make notes. Okay, it is good to make notes of the important topics. And also it is good if you do not have the habit of making notes. I at least suggest you that make notes for those topics which you find difficult. There are a few which are being asked repeatedly and they are important to know. But if you feel that you find yourself weaker in those ones, so have the practice of making notes and revising them. Okay, these notes comes very handy in the last few weeks of preparation, where you can just brush up through your notes and solve questions and you're good to go. So yes, make notes and yes, revise. Okay, last 1 to 2 weeks should be dedicated to focused revision, so that you just do not keep on reading new topics few days before your exams, and make sure that you revise so that you do not forget the topics which you have already read. Okay, so I have a question here. I have taken this question from clinical case of FOP, clinical cases of FOP. And this is just to, give you an example of what kind of questions are being asked in FOP exam. So you can see here the question mentions, a 2-month-old breastfed boy presents with a long history of crying after feeds, being generally unsettled and with loose stools, which have been bloody on several occasions. He was born at 39 plus 5 weeks following a normal pregnancy. Weighing was 3.4 kg, which was between 25th to 50th centile. He has been breastfed from birth and been prescribed sodium alginate by his GP for reflux disease. He has regular emollient for eczema. On examination, he weighs now 6.6 kg, which is falling between 98 to 25th centile, and is alert and responsive. He is unsettled and crying when you examine him. His heart rate is 130 per minute. Central capillary refilling time is 2 per second. And apart from some moderate eczema, his systemic examination is otherwise normal. Okay, so this is a scenario which is given to you. And here, first of all, you have to make the diagnosis. Okay, you are required to make the diagnosis first, and then only you can, plan on the next step of management, which they are assessing here. That is, what is the most appropriate first-time investigation. So only when you make the diagnosis out of this clinical picture which has been given to you, you will be able to plan the next step of management. So you can just see from here that there are some keywords that you have to pick. That the baby is having history of crying after feeds. Baby is having loose stool, which are bloody on several occasions. Also, the baby was full term and the birth weight was good, 3.4 kg. But now when the baby presents to you, the weight centile has fallen. It now ranges between 98 to 25th centile. And also, there has been reflux disease in the baby, for which the GP has advised sodium alginate. Moreover, there is eczema present in the baby. Okay, so there is loose stool with blood in the stool on several occasions, with eczema, with reflux disease, with fall in the weight. Okay, and otherwise systemic finding is quite normal. Okay, the baby is not in shock, so you can rule out septicemia. So what is the most likely clinical picture that you can think here? Do you feel it is taking you somewhere towards cow milk protein allergy, CMPA? Okay, so this is a case of, CMPA. In the previous question, the history leads you towards cow milk protein allergy. And the specific key points that you have to note in the history is history of gastroesophageal reflux and the treatment for eczema, especially when it is not responding to the standard treatment, and the new onset bloody stools, and also the infant is never settled after feeds. Okay, so the risk factor for CMPA is a history of atopic comorbidities, in this case eczema, but asthma is also a risk factor, along with a family history of atopy. Okay, so in your clinical scenario here, you have been given the history of eczema, but also someday some other exam you can have family history, which is positive for atopy, or maybe history of asthma must be given. Okay, so this way you can draw your conclusion that we are dealing with the case of cow milk protein allergy. Okay, and if IgE mediated allergy is suspected, a skin prick is indicated, and if non-IgE mediated is suspected, then a cow milk elimination diet for 2 to 6 weeks for child or mother is being advised. So in our case, this baby was breastfed. Okay, baby was exclusively breastfed. So it is wise to tell mother to avoid dairy products, to avoid taking milk, so that the baby, when the baby breastfeeds, there is no milk protein in the breast milk present. So C is the answer for this question. Okay, trial of maternal trial of maternal dairy-free diet. Okay, all right. So this was about, this was one example of FOP question. Coming on to next question. So this question has been taken from clinical cases of TAS. Okay, so let's see how they judge your knowledge. Pardon me. A baby is born with abnormal external genitalia, which you suspect to be very virilized female genitalia, as there are no palpable gonads. Okay, so we are dealing with ambiguous genitalia, and birth and antenatal history are unremarkable, and there is no significant family history. You know that congenital adrenal hyperplasia is the likely cause of such a presentation. Okay, So the question asks you, which of the following are the most relevant immediate diagnostic test? So, I have taken these two questions because they are testing the same knowledge of, the investigation that you can go for when you have known what condition you are dealing with. But as you can see in the question which we talked previously, there you had to make the diagnosis based on the clinical picture given to you. Whereas in your task exam, most of the times you are given the diagnosis. Like here, you are given the diagnosis of congenital adrenal hyperplasia, and you just have to, you just have to tell which diagnostic test would be best for this patient. So this is how these two exams differ from each other. Okay, but yes, definitely there is a catch. Okay, look at the options that they give you. So karyotyping definitely would be done because we are dealing with ambiguous genitalia, and you have to answer the patient's relative if the baby is a girl or a boy. Okay, and also this question is being asked in the ethical scenario that if you are dealing with a patient with ambiguous genitalia, and then the relatives ask you, the mother asks you if the baby is a girl or a boy, what do you do? Okay, so in those scenarios, you have to say that if you have to mark those options, which says, hey, you have to first go for karyotyping, immediate karyotyping, and you have to wait before the report comes. Okay, you cannot answer them. You have to defer answering them till the report comes. Okay, right. So yes, karyotyping has to be done. But what about the other test? We are dealing with the case of congenital adrenal hyperplasia. So 17-hydroxyprogesterone is a screening test which is being done, which is found elevated in a case of CAH. But then we have option which says you have to send it either immediately or send it after 72 hours. So what do you choose? Okay, so understand the fact that 17-hydroxyprogesterone is, an adrenal metabolite. Okay, and right after the birth, the fetal adrenal is very metabolically active, and 17-OHP and other adrenal metabolites are normally high in the fetus and in first few days of life. So the results can be difficult to interpret in the initial few hours, few days of life. So it is best to wait for 72 hours, okay, and then to send the report for 17-OHP. So the answer which best fits here is option E, which says karyotyping must be sent immediately, okay, because you need to know the karyotyping as soon as possible, followed by 17-OHP after 72 hours. You have to defer this test for 72 hours. Before that, you can be misled with your reports. Right. Okay. So moving on to the day of exam, how do you, what do you do on your big day? So, this advice is being given by most of the people, but still, we tend to overlook. But believe me, you need to have a good sleep a night before. Okay, it is very, very important because how much ever you read, you have to be productive. You have to be effective on the day of exam. Okay, so have a good sleep a night before and have a good breakfast. Reach your exam center before time. In your document, with time and also the time at which the exam is going to start. So you have to reach your exam well before your registration time. Get acquainted to the surrounding of your center, okay? And if you are giving online invigilation, make sure you have your system checked and set up before exam day ready. Make sure you have your surroundings clear of all the disturbances. So online invigilation is one of the options which is given to you by MRCPCH, where you can sit for the exam with some standard setup at your own place, at your own home, or in a private setting. Okay, in a private place where you can have a similar resource, so you can sit for the exam with your own setup. yes, there are a lot of guidelines given for it, like what are the requirements, what are the must-do things you have to do, and it is very well mentioned in the RCPCH site. And if any of you are sitting for online invigilation, and if you have any doubt, see, personally, I have not given any online invigilation, so I do not have in depth, not definitely. If you have any query, you can ask me. I'll just go through the content and let you know. Okay, but despite this fact, if you have any doubt, you can directly reach to RCPCH, and believe me, they are very prompt with their replies on their emails. Okay, so yes, then yeah, carry your admission document and identification document. Okay, identification document can include your passport and also your national ID. Okay, so yes. Now, how to attempt questions. So when you're sitting for your exam, it is very, very important. Again, this is this question. Okay? Avoid making silly mistakes whenever you are, missing out on words like which of the following is correct. The following are and you have to find the correct state, okay? And you are given most of the correct statement and you have to false one. So there are some words like accept, false, true, correct, incorrect. You have to of it that do not listen.
Dr. Ashna, you have to share your screen again.
Okay. All right.
Yeah, we can't see your screen, ma'am.
So which is the last slide which was visible to you about
Ma'am,
the
on
You were on
question?
the D-Day, ma'am.
Okay. Okay. So coming back, and make sure you read through the question properly, and you are get distracted with the long questions and useless information which is given in between the questions. And also there is option of highlighting the text which is given in the question. See, as far as I remember, when in the mouse, when you press the right hand side button and drag it, it highlights the text which is given to you in the question. So you can use that feature, and you can use that to highlight keywords, especially when you are towards end of your exam and you are really fatigued.
Ma'am, you need to again share your screen.
Asma, do I need to share again?
Yes, ma'am, you have to share again. There was some interruption due to which the slides were removed. You have to share the screen again.
Okay, no issues. Okay, is it visible now? Is my screen
Yes,
visible
ma'am.
now?
Yeah, it's the screen is loading now. Yes, the slide is visible.
Done?
You can start.
All right. Okay. So yes, as I was talking about, focusing on the keywords, and then yes, definitely keep a track of time. You have given number of questions, divide your time well, and arrange, decide on your timings in such a way that you have last to 15 minutes of buffer left for yourself. Make sure that you finish your 15 minutes or 10 minutes well before time. Okay. And believe me, the exam is not very healthy. I have not really known anyone who has missed out on solving questions or missed out on attempting questions. For a slow solver like me also, I have managed to finish it well on time. Okay, so time is never a factor, has never been a factor till now. So yes, definitely you first instinct. Most of the times what happens is when we solve MCQs, we with the first reading we mark an option, and then when we tend to revise, when we go through that question again, we tend to change our answers. Our mind starts overthinking, we tend to change answers, and most of the time it comes out to be wrong when we change it. So it is best to go with your first instinct. Okay, and avoid making many changes into your answers during second check, except when you have read or interpreted the question wrong. Okay, all right. So keep yourself hydrated, but avoid drinking excess water. You know why. And then take deep breaths in between the exam. Okay, right. So there are a few upcoming changes in the theory exam, which will start from the third date of theory exam, that is September 2024. Okay, this is what has been given in the RCPCH site, that it will be effective from 2024.3 examination date. All right, and what are the changes we will see now. So in foundation of practice, there will be 100 best of 5 single best answers. Okay, in each exam. So in FOP exam, you'll have 100 questions. Okay, and each question will worth 1 mark, and the time allowed for the examination will reduce to 120 minutes. So earlier what used to happen is, there were not fixed number of questions. Sometimes they used to give sometimes 90. Okay. Question which was excellent matching question, right? If and so most of the out of the ones which are time you have is 120 minutes. So even if you give 1 minute to one question, it's 20 minutes left with you. Okay. So, yeah. Then to theory and science, again there will be
Ma'am, you need to reshare your screen again.
Is my screen visible, Asma?
Ma'am, you have to reshare your screen. Yeah, it's visible now.
Okay. Okay.
Thank
so
you.
yeah, theory and science, again, yeah. Again, each question will have 1 mark each, and the time allowed for you is 120 minutes. Okay. So, this is the most worrisome thing about the candidates who are going to appear for the next site, whereby the changes are going to take place. And the most frequently asked question is it going to get tougher? So yes, this change has been brought up by RCPCH, but believe me, they do not tend to make things difficult for you or tougher for you. They just want to standardize their way of assessing your knowledge. Okay, so most of the exams which are held internationally are of same standard or of same type, that is best five, best of four. So yes, they want to standardize their examination. So there are no, they are not changing the standard or the complexity exam. Regardless of the format, each exam will contain harder and easier questions. So uh, around 10 to 20% of the questions will be hard. Around 30, 40 to 50% of the questions will be easy, and in between you will have moderate, level of questions. So yes, that remains the same. The proportion of difficult question and easy question will not change. And this is accounted for at standard setting to ensure the same standard is applied. Okay, these are words of RCPCH to justify that the change have made in the exam setting. Talking about the months before exam, how to strategize for the last 2 months. So believe me, these last 2 months are the most important time, and you just cannot lose your focus here. And it is best to read notes. If you have made notes, it is best to read your notes, go through them, and consolidate your knowledge of the topics which are important, and focus on, again, high yielding topics. And repeat saying that, because every exam has a pattern. All the exams which I have appeared in my life till now, which are quite a many, so all of them, they have pattern. Believe me, every maker, they are clear in the mind. They need to assess few things which they consider important according to their system, their clinical scenarios. They ask those cases, those conditions in the exam. So yes, focus on those topics. Don't forget the importance of revision. Make sure that you revise in the last few days, last few weeks of your preparation. Okay, and invest half of your time in studying and other half in solving. So when you have to study, do the revision also, and the rest half devote in solving questions. And yes, manage your title. Most of us working while we are giving this, and some of us even have to manage it.
The screen is not visible again, ma'am.
Dr. Asma, please share your screen.
Sorry, can you come again?
Thank you. Please. Yeah, it's visible now.
Okay, okay, nice. So we were talking about managing our time. So yes, manage your time well, and make sure you are completely focused in the last 2 months. And if all if you are someone who is for some 4 to 6 months and giving 6 months in preparation, recall something which you should focus more on during your last phase of preparation, that is the last 2 months. Recalls are of not much importance when you start your preparation. Just because you get with the questions which have already been asked, I won't suggest you start with them, but yes, you have to finish your preparation with them. Okay, yes, last 3 to 4 years of call papers are,
Dr. Ashna, you have to reshare the screen again.
visible.
No, ma'am, it's not visible right now.
I've shared it.
Can you please reshare the screen, ma'am?
Yeah, sure. I'll do that.
Yeah, it's visible now.
Now it's visible now.
Okay, cool. Right. So, solve recalls in the last few months, specifically last 2 months of your preparation, and identify your weak areas and supplement those with more reading. Okay, all of us have some weak areas or some areas which we do not like to get into, few topics which we do not like, but you have to brush through them. You have to know, especially topics like ethics and safeguarding. Sometimes it gets a little boring, but they are must do. Okay, and whenever you feel you are weak with them, make sure that you read them again and again. You make notes, you revise those notes again. Okay, right. All right, so this is one way of reading, that is you first read a topic and then solve questions, or you can solve questions and then go back to the topic. This I'm talking about the last 2 months of preparation. Avoid the reading, you can resort to any. I personally like way of reading. I'm going to solving questions. Sometimes I get bored, I solve questions and I go back to the topic. So yeah, forms a good way of reading for your last 2 months. So yeah, we are done with the presentation session. And do we have any questions?
Thank you so much, Dr. Ashna, for giving us all the insights about MRCPCH. I guess all the queries that the students were having, like how to start, how to solve the questions, what's the new pattern, I guess it has really helped them.
Thank you. Yeah.
Welcome. So Dr. Ananya, Dr. Osama, how are you all? Dr. Rashmi, do you have any questions? You can write in the chat box. We have given our course counselor number as well. If you want to join any course, if you want to know any other insights, we're going to plan these kind of webinars more often. So you can share your amazing topics as well. Do you have any queries? Or mentors will be there for your guidance. So yeah, Dr. Ashna, lovely to see you. I guess that was all for today's session. And if anybody has any query, we're going to solve that. So let's end the webinar now.
Thank you, Dr. Rashmi. Thank you.
So thank you all for joining us today. Let's meet again in the next webinar. And that's all. Take care of yourselves. Thank you, Dr. Ashna.
Thank you, Asma. Thank you. Bye-bye.
Bye-bye.